Have you ever heard of an aneurysm? Sounds scary, right? But what exactly is it? Let's delve into the world of medicine for a moment and simplify this term. Picture your blood vessels as a network of pipes, transporting life-sustaining blood throughout your body. Now imagine a weak spot in one of those pipes, causing it to bulge or balloon outwards. That, in essence, is what we refer to as an aneurysm. This abnormal dilation can occur in any blood vessel, but it's most commonly seen in the arteries of the brain, the aorta, and the legs. While many aneurysms don't rupture or create health problems, some can burst and cause life-threatening internal bleeding. It's a silent challenge, often going unnoticed until it becomes severe. So, an aneurysm is a ballooning blood vessel. But did you know there are different types of aneurysms? Now that you know what an aneurysm is, let's dive into the three common types: brain aneurysms, abdominal aortic aneurysms, and thoracic aortic aneurysms. Firstly, brain aneurysms, also known as cerebral aneurysms. These are bulges in the blood vessels of the brain. They're like time bombs, sitting quietly until they rupture. The rupture leads to what's commonly known as a stroke, which can be life-threatening and requires immediate medical attention. Next, we have abdominal aortic aneurysms. The aorta is the main blood vessel that supplies blood to your body, and it runs from your heart through the center of your chest and abdomen. When an aneurysm occurs in the part of the aorta that's in the abdomen, it's called an abdominal aortic aneurysm. These can grow slowly over time without any symptoms, making them incredibly tricky to detect. If they become too large, they can rupture, causing life-threatening internal bleeding. Lastly, there are thoracic aortic aneurysms. These occur in the part of the aorta running through the chest. Similar to abdominal aortic aneurysms, these can grow slowly and often without symptoms. If they rupture, they can lead to severe sudden pain in the chest or upper back and can be life-threatening. Each type of aneurysm carries its own risks and complications. But how can we diagnose an aneurysm? Diagnosing an aneurysm might not be as straightforward as you think. It often involves a combination of laboratory and radiologic tests, each with its unique role in detection. Let's begin with a computed tomography scan, or CT scan as it's more commonly known. This test uses X-rays to create detailed images of your body, allowing doctors to spot any abnormal bulges in your blood vessels. Next up, we have magnetic resonance imaging, or MRI. This test employs magnetic fields and radio waves to generate images, offering a different perspective on your blood vessels. Finally, in certain cases, a cerebrospinal fluid test might be necessary. This involves taking a sample of the fluid that surrounds your brain and spinal cord to check for signs of bleeding caused by a ruptured aneurysm. These tests help doctors detect aneurysms, but what signs and symptoms should you look out for? The signs and symptoms of an aneurysm can often be subtle and overlooked. Aneurysms, like silent intruders, can go unnoticed until they cause a significant medical event. However, they do have telltale signs that vary depending on their location. A brain aneurysm might cause headaches, vision changes, or even difficulty speaking. On the other hand, an abdominal aneurysm might present as pain in the back or side, a pulsating sensation in the abdomen, or unexplained weight loss. A thoracic aneurysm can cause chest pain, back pain, or shortness of breath. It's crucial to remember, though, that these symptoms can also be linked to other medical conditions. Hence, it's important not to jump to conclusions, but rather seek medical advice if these symptoms persist. Early recognition is the key to effective treatment. So listen to your body and consult a healthcare professional if you have concerns. Knowing the signs and symptoms can save lives, but what happens if an aneurysm isn't treated? Let's find out in the next segment. Untreated aneurysms can lead to serious, sometimes fatal complications. Now that's a sobering thought, isn't it? It's crucial to understand that aneurysms are no laughing matter. They're silent, they're hidden, but if left unchecked, they can wreak havoc. One of the most concerning complications is a rupture. Imagine a water balloon filled to the brim and beyond. That's an aneurysm. Now imagine that balloon bursting. That's a rupture. When an aneurysm ruptures, it causes bleeding into the surrounding area. This can lead to a hemorrhagic stroke, spinal cord damage, or even death, depending on the location of the aneurysm. Another complication is what we call a leak. Sometimes an aneurysm doesn't burst all at once, but instead, it leaks a small amount of blood. This can cause a sudden, severe headache, often described as the worst headache of my life. It's a warning sign that the aneurysm may be about to burst. But there is a silver lining to this seemingly dark cloud. Aneurysms can be treated, and these treatments can significantly reduce the risk of rupture or leak. One such treatment is surgery. There are two main types of surgery for aneurysms. The first is an open surgery, where the surgeon makes a cut in your body to reach the aneurysm and repair it. The second is a less invasive procedure, where the surgeon threads a thin tube through your blood vessels to the aneurysm and seals it off. But not all aneurysms require surgery. Some smaller ones, especially those that aren't causing symptoms, can be managed with medication and regular monitoring. These medications can help lower blood pressure, relieve pain, and reduce the risk of rupture. So while aneurysms can be frightening, remember that knowledge is power. Understanding the complication and knowing the treatments can make all the difference. Treatment can significantly reduce the risks associated with aneurysms. But who is at risk of developing an aneurysm? Well, that's a subject for our next discussion. Stay tuned. Certain factors can increase your risk of developing an aneurysm. The first of these is age. Aneurysms are more common in adults than in children, with the risk increasing as we age. The second risk factor is a history of smoking. The chemicals in tobacco can damage and weaken the walls of your blood vessels, making an aneurysm more likely to form. High blood pressure is another significant risk factor. It can apply a great deal of pressure on your blood vessels, which may lead to an aneurysm. Now that we've identified the risks, let's discuss prevention. Regular checkups are vital. These appointments can help catch an aneurysm early when it's easier to treat. Next, consider your lifestyle choices. A healthy diet and regular exercise can keep your blood vessels strong. If you're a smoker, quitting can reduce your risk. Managing existing health conditions is also crucial. If you have high blood pressure, diabetes, or high cholesterol, keeping these conditions under control can help prevent an aneurysm. Medications and lifestyle changes can play a big role in this. In a nutshell, preventing an aneurysm involves maintaining a healthy lifestyle, getting regular checkups, and managing any existing health conditions. It's all about taking good care of your body and your health. While aneurysms can be frightening, understanding them is the first step in prevention and treatment.